Okay, so you may be lying in bed at 2 a.m., just wide awake again. You're tired, maybe your mind is racing, your body just feels off, and you find yourself wondering, is this just part of getting older, or is there something actually wrong? Hi, I'm Dr. Lola Ashaye. I'm a board certified family and lifestyle medicine physician and founder of InTouch Primary Care in Sugarland. And at InTouch, we just don't treat conditions. We change how people experience healthcare. So many of my patients come in, they feel frustrated, unheard, they feel overwhelmed after years of rushed visits and unclear answers. And what we focus on doing is just slowing things down, truly listening, and connecting the dots in a way that brings clarity, confidence, so that people can understand what's happening in their body and know what to do next. And over the years, I've spoken to many women who tell me something just doesn't quite feel right. Maybe they've been telling themselves, I just need to push through this. After all, that's what they saw their mothers do. But life is faster now. Many people have a lot of responsibilities, more stresses, and some women are having a really hard time keeping up. And sometimes they're not sure. Is it just stress? Is it hormones? Is it something more serious? And many times they choose to wait and they wait. And then until it comes to a point where the symptoms really start affecting work, it starts affecting their sense of self, their mood, their relationship, and then they finally seek help. But I want to talk about that today. You don't have to wait that long. So, here's the truth that a lot of women are not told. When you're going through perimenopause and menopause, sometimes they think everything is just normal. So even if it's common, that doesn't mean you have to live with it. So I want to simplify it kind of the way I think about it in three categories. So the first category is things that are expected. So for example, in perimenopause, menopause, it's expected many people will have hot flashes. Some people have sleep disruption, brain fog, mood changes. These are very common, but that doesn't mean you have to just deal with them. Okay, but they're expected. They're things that happen during that time period. Now, the other way I think about it is there could be things that signal something needs attention. For example, if you have severe fatigue, like you're tired all the time, or you have very heavy or irregular bleeding, because that can cause anemia, which can cause many other things that truly affect your health. If you're noticing rapid weight changes or your hair is thinning, these may still be hormonal, but they deserve a closer look, because some people have, thyroid disease, they may have insulin resistance, and these things can truly impact your health. The sooner they're addressed, the better. And then I think about red flags, the things that shouldn't wait, that shouldn't be ignored. So, for example, chest pain, or if you're bleeding, if you're having like a period after you've not had a period for a whole year. So, you're in menopause, you've not had a period for a whole year, and then you start having what looks like periods again. That can actually be uterine cancer, and that needs to be checked out. If you're having severe or sudden headaches, heart palpitations, these are not things you should just wait and see. These are things that should be addressed sooner than rather than later. And if you're not sure, so that's the thing. And that's, one of the things that need to be figured out, not just ignored, especially when you're not sure if you have symptoms I haven't mentioned. All these are just examples. Obviously, you want to check with your own doctor as well. So here is where many women get stuck, right? They think, if I go in to see the doctor, they're just going to push hormones, or maybe they're not going to understand or listen. Or they may think, I don't want anything complicated. I just want, a simple answer, a simple solution. Or they may even think I should be able to handle this myself. After all, other women have. But the thing about it is perimenopause and menopause don't show up the same way for everyone. It's just like with pregnancy, right? Some people have very complicated pregnancy and need a lot of help, and some just have a very simple pregnancy. I joke that they can birth the baby themselves. So each woman's experience is unique, and that's how it is for the transition as well. And real care should feel like you understand what's happening in your body, you're looking at the full health picture, and you're exploring all the options, not just one path. And that's another thing that I've seen lately. There's a talk about a lot about perimenopause and menopause, but a lot of people are pushing one thing or the other, not giving people the range of options. So what do we do here at InTouch Primary Care? So when you come in, the goal is clarity, not overwhelm. So just think about it this way. You don't have to be overwhelmed. What we'll do is evaluate your symptoms, figure out what's actually happening. Is this hormonal transition or is this something else? Then we review your health history. So we want to get the bigger picture. What are your risk factors? What is your family history? What are the things that we need to prevent, not just things that are happening right now? And then we understand your goals. What matters to you? So what may be priority to us may not matter much to you. You may be willing to power through some symptoms or not. So we need to figure out what actually matters to you. And then we walk through the range of options. So there are many options. It could be lifestyle changes, it could be targeted supplements, it could be non-hormonal therapies. And then there are hormonal options if appropriate. The key is you are not stuck. You have choices, you have options. So if you've been asking yourself, do I need to see a doctor for this? The question alone is your answer. You don't have to wait until it gets worse. You don't have to figure it out alone. And if you're in Texas, you want help in connecting the dots early before this starts affecting the quality of your life. That's exactly the kind of care we provide here at InTouch. Personalized, relationship-based care where you're not rushed, where you're not guessing, where you're not left trying to figure it out on your own. Our goal is simple: to help you understand, to help you feel confident in your decision, and to help you have a clear plan forward with a doctor who gets to know you and not just your chart. So, if you're interested, schedule a free 15-minute consult so we can walk through how our services work, answer your questions, and help you decide if this is the right fit for you. The link for that will be in the bio. And if you're not ready yet, that's fine. Just save this video, share it with somebody that might need it, and look for it whenever you're ready. So, but just imagine, so instead of waking up at 2 a.m., wandering, drenched in sweats, or having hot flashes, you wake up feeling rested. Your mind feels clear again. Your body feels like it's yours. You're not guessing anymore. You're not pushing through. You understand what's happening, and you have a plan that actually works. So that's where we're going. Hope this helps.